Okay, everybody, we're going to go ahead and get started. Thank you so much for joining us. My name is Emily Lakemaker, and I'm the Associate Director of Recruitment and Student Life here at the Rollins School of Public Health, and I'm joined today by one of my colleagues. She'll introduce herself in just a minute, but first off, we want to get some basic logistics out of the way. First of all, we are recording this, and so we will be posting this to our YouTube channel. Usually it takes us about 3 to 5 business days to get this up. We'll email everybody that's registered the link once it's up and posted and live for you to watch. So if you want to go back and rewatch anything or if you feel like you missed something, you'll have the opportunity to do that. If at any point you have any questions, you can type them. There should be a little box in the upper right-hand section of your screen, and you can type in your questions there at any point during the webinar, and we will go through those and answer as many as we can at the end of the webinar, go through as many as we can within the hour that we have allotted, and we'll just read those aloud and then answer them for you. So feel free to type those in at any point during the webinar. So I think pretty much that's it. So at this point, I'm just going to go ahead and turn it over to Megan and let her take over from here and get started with the actual webinar.
Great. Hi everyone, my name is Meghan Sullivan. I'm one of the academic advisors in behavioral sciences and health education, more affectionately known as BSHE. And so I'm going to talk to you a little bit today about our mission, our research, our curriculum, as well as the admissions process a little bit. And so like Emily said, if you have any questions throughout, feel free to go ahead and type those, and we'll have a question and answer at the end. So to best understand BSHE, I wanted to start off with our mission, which is to better the health of all people by advancing knowledge and training tomorrow's leaders in how to change behavior in social conditions that influence health. And one of the ways we do that is through our research. So faculty in behavioral sciences and health education have identified 4 major research areas, and those would be behavioral risk factor trajectories, social determinants of health and health disparities, health education and behavioral interventions, dissemination and implementation of effective interventions, which we apply to a number of different more subject-based areas. And these are just some some examples, and you can see the broad range that's really addressed, and those would be sexually transmitted infections and HIV acquisition among high-risk populations, both in the U.S. and abroad, factors that influence early unplanned pregnancy, cancer prevention and control, so a lot of chronic disease projects, mindfulness interventions to prevent and manage depression and anxiety, so mental health is also another big research area for us, and we would definitely encourage you to visit the website. We have a very up-to-date list of all the different research projects that are going on, and you can see, because this is really just a sample, can see what great research we do have going on. And our students can get involved in our research here within the department, as well as at university, or university as a whole. So another big part of our mission is to train tomorrow's leaders, which would be who you all are. And so you can see the number of different skills that we do teach. One of the really great things that I think is, so say for example, if you take a class on grant writing or you take a class on community needs assessment or evaluation, not only do you learn in the class in BSHE, you also usually apply that to a community-based organization that needs a community needs assessment. So not only are you learning the skill, you're also building your resume at the same time. So you're really getting some real-world training while in the classroom in BSHE. So kind of transitioning over to our requirements and curriculum a little bit, to just talk briefly, it's a 42 credit hour program. It does take 2 years, so it would be fall, spring, and then fall, spring once again. You do have the option to complete either the behavioral sciences or health education track, and you can do both, and we'll talk a little bit about what that would look like. And then we do have the practicum requirement, as well as the culminating experience requirement, which can be the thesis or the capstone in BSHE. So our curriculum, so moving from left to right is how each semester would look. So in your first semester, you would take statistical methods, theory and behavioral sciences and health education, and behavioral methods. If you did choose to take the 4-credit EPI, you would also take that in your first fall. Moving on to the spring, it would be BSHE 532, quantitative analysis, which whereas the BIOS 500 class you would take in the fall is more SAS. You do learn SPSS in BSHE 532. So in BSHE, you would graduate knowing both softwares. And then you'll see if you did not take the 4-credit EPI in the fall, you would take the 2-credit EPI in the spring. And then you see the different colors for the tracks. So if you ultimately decided you wanted to be behavioral sciences track, you would take BSHE 550R in the spring, and then the following fall take grant writing. And if you decided you were health education, you would take principles of curriculum and instruction in the spring, and then take community needs assessment in the fall. Now, if you just decided you wanted to do both tracks, you would just take both courses. And we do have a number of students who do choose to do that. And you'll see the following fall, if you do choose to do the thesis, you would enroll in thesis mentorship in the fall, and we talked about those track courses. You'll also see some other RSPH core courses, which are environmental health, U.S. healthcare system, and critical issues in global health. Like history of public health, they have an asterisk because you can really take those in any semester, and the same with the 5 credits of BSHE electives. We do recommend that you do take history of public health sometime within your first year, but like the others with an asterisk, it can really be taken in any semester. And you'll see typically in the spring, in addition to any electives students may have to take, they typically have conduct of evaluation as well as either their thesis or their capstone. And so some things I want to highlight, as we talked about before, are the community partnerships within those courses. And the unparalleled access you do have here in Atlanta. It is the capital of public health capital of the world. So some really great opportunities, not only outside the classroom, but within the classroom as well. And then to talk briefly about strong mentorship, I'm one of 2 academic advisors in the department. In addition to that, you'll also be paired with a faculty mentor who shares similar research interests as you. And also we have a great career services department at the school, situated right here, just a few floors above us. So students typically have a few more questions about the practicum as well as the CULMINATING experience, and I just wanted to run through some examples quickly. So the practicum is a 200-hour experience. To talk briefly about work at BSHE, in BSHE, in addition to the coursework, students are typically working between 10 and 15 hours a week. We do have to have 200 hours of that on record and documented for accreditation purposes, and that would be your practicum. And you can see some of the organizations that our students have worked with. Of course, the Centers for Disease Control and Prevention, which is right next door. I had a student over the summer work at Save the Children. In Bolivia, the World Health Organization, Dana-Farber Cancer Institute, Deloitte Consulting. And then to talk a little bit more about the CULMINATING experience. As I mentioned earlier, you can either do the thesis or the capstone in BSHE. And we'll have plenty of sessions to help students make those decisions. So it's not something a student would have to know coming in. And you can see all the different past examples that we have had under both of those topics. And talk a little bit more about the curriculum. One of the really great things at Rollins is we have these school-wide certificate programs that students can gain focused learning in an emerging area of public health. So if you're looking for that intellectual, interdisciplinary home, that's also a great opportunity as well. They're all going to differ in terms of what their academic requirements would be. I have highlighted the top 3 for BSHE students in terms of what our students which ones our students tend to pursue. The socio-contextual determinants of health, mental health, maternal and child health. But we also had students complete the ones that aren't bolded. I would just say that they're a little bit less popular, but definitely an option. And those are not, you don't have to make any sort of decision prior to coming here, what you would like to do. We have sessions to help students figure it out, and you do not have to do a certificate, it's just an option. So to talk about our admissions process a little bit, I know some of you may be thick in the process, but we do want to highlight some things. One would be that we're definitely holistic in our admissions decisions, meaning that we do review everything that comes to us as part of your application. So it would be your SOFIS application, your transcripts, your test scores, your letters of recommendation, your experiences, your personal statement. So the admissions committee really looks at all of that in making a decision, not just one thing or another. And some other things I do want to highlight is that we're SOFIS application exclusive. We do have a priority deadline coming up, which is January 5th for merit scholarship consideration. And we are rolling admissions. So once the admissions committee has made a decision on your application, we will notify you of that decision. So usually the next question is funding opportunities. So you'll see here on the left, in terms of aid, we do offer merit scholarships, mission-driven scholarships and financial aid awards. You do have to submit a FAFSA in order to be considered for any financial aid awards that we do have. Some other options that help our students to really gain meaningful work experience here. One would be the Rollins Earn and Learn Award, which does work as a work-study program, and that Rollins will help to fund your position in a public health organization. Like the financial aid awards, you do have to submit a FAFSA in order to be considered for the Rollins Earn and Learn Award. And then we do have a lot of students who are interested in pursuing out-of-country experience, whether it be for their practicum or another opportunity. And our students have been competitive for things like the Global Field Experience Award and the Global Health Institute Award. And those two are in different colors because those are only for current students. So it would be something that you would apply for once you're already here. And I do have the links to all of the different opportunities, so you definitely feel free to review those. And then finally, before we go into question and answer, I did want to highlight, if you plan to visit campus anytime soon, the link to schedule an admissions office tour as well as an info session is right there, as well as the department does offer some BSHE specific visits, which would include a meeting with an advisor, a meeting with a student, a meeting with a faculty member, and possibly sitting in on a class. And there's the email address for that. It's just bshe@rollins@emory.edu. So we're going to move on into questions.
All right, so if you have any questions, feel free to go ahead and type them into the question box, and we're just going to read these aloud and go through and answer them. So Edgar is asking, do you teach qualitative methods?
Hi Edgar, yes, we definitely do teach qualitative methods. You can review the course catalog online. They would be BSHE 538. And then we also, if you're very interested in qualitative methods, we also offer qualitative analysis, which is the follow-up course to that, which is BSHE 539. And students can take BSHE 538 as early as their first spring, and qualitative analysis is offered in that fall. So yes, definitely opportunity to take that coursework.
All right, Michaela is asking, of the statistical programs that can be learned, why SPSS over other stat programs?
The faculty have definitely looked at what, the curriculum, and have decided that, in terms of what BSHE graduates use in the field, that's what it's important that we teach that in BSHE 532.
And Iona asks, what type of jobs do BSHE graduates have?
So what type of jobs do BSHE graduates have? Of course, we're always going to have those students who either, have jobs that are in the department name, for example, behavioral scientist or health educator, but our students really do quite the range. We have students who work in consulting. We have students who work in school health, so there really truly is a range. We do teach the skills, as I mentioned earlier, and so it's up to you to decide where you would like to apply those skills and in what setting.
And also, just to kind of piggyback on that, on the Rollins website, under our careers page, they put a, it looks like we've also got a question about placement rates. I think this will play really well into Renee's question, who's asking about placement rates for post-graduation, and do most graduates stay in the Atlanta area. So as I was saying, on the Career Services website, within the Rollins website itself, we have, I think it goes back to about 5 years of graduation surveys, and this is where our Career Services office surveys students a year after they graduate to figure out where they are, what they're doing, and what they're making. And we publish this information for you guys to see, so you can break that down by department. So you can go and look and see the past 5 years of data of where BSHE students have gone, actual job titles that they have, the locations that they're working at, and usually some type of salary range. It's not necessarily exact, but it kind of gives you an idea. And the thing to keep in mind with all those is that those are just the first year out. So, that's just 1 year of experience, maybe first job out of the master's program. But I think it's a really good way to see, where students are going, actual real life job titles. In terms of placement rates, I mean, most of our students are going on to get full-time employment. It's something like, I think about 88% of those are full-time employed within a year of graduation, but those remaining 12%, I think of like 11 of those are going on to pursue higher ed, like another form of education, whether that's their doctorate or another degree. And then really it's literally just like 1% that may not have found something that's in the full-time range within a year of graduation. Most of our grads do stay in the Atlanta area. but they our two other largest markets outside of that would be New York and DC, New York City and DC.
And I will also say that, we do have students who usually if they're staying in Atlanta, it's because they want to stay in Atlanta. I've had students who will choose to go to other locations and have definitely been competitive in those job markets, even if they're not our most popular per se.
Mm-hmm.
So a question from Olivia, and it says, if you've already have a bachelor's in community health, is it possible to test out of classes already taken? And so there's not necessarily a test out option, but we do have a waiver process in which we would ask to see a syllabi, syllabi as well as your transcript, and faculty will review it to see if you still need to take the course. But that would be a process that you could start once you're already a student here.
All right, and Liana has a similar question. We kind of talked about this earlier, but the statistics on how many BSHE students go on to do continued education. I don't know off the top of my head the breakdown of that. I know overall with all of our graduates, it's about 11% that go on for a further degree after that. Megan, do you have a breakdown?
Yeah, so I don't have a breakdown, but I do, note anecdotally that we will have some students that will pursue a doctorate degree either directly after their MPH, or we do have some students who've come back and have told us, I've worked in the field for a few years and now this is what I'm decided to do. What's really great is that we have great mentorship in BSHE. So you'll have a faculty mentor from day one. So if that's something that's of interest to you, we definitely encourage you to connect with your faculty mentor on that as somebody who's already been through that process and can really help you with that. And if you establish a great relationship with that person, you can later, they could possibly write recommendations and so forth.
All right, Cordell has two questions. First one, how many students receive the merit-based scholarship? So we award about 40 merit-based scholarships each year. So it is incredibly competitive for those. And so that's one of the reasons why we wanted to give you some of those other funding options that Megan talked about, everything from real to some mission-based scholarships, as well as feel free to also look at any outside funding opportunities that you may be interested in as well.
And it does look like Olivia kind of piggybacked off that question, asking how many students receive the real award each semester. And about last year, we had about 450 students who did utilize the real award. So it's not only just they received it, but then put it into practice as well.
Yeah, so just receiving it, because you do, with the real award, it just means that you're eligible to apply for those jobs that are part of that program. It's not a placement opportunity, so it's not a placement program. So you still have to apply for jobs and interview and secure one, but it does mean that you are eligible to apply for those. Cordell's second question is, if we are admitted into the program, are we assigned an advisor or can we request a specific one?
So in terms of academic advisors, which would be myself and my colleague, students are assigned by last name. In terms of faculty mentor, we do review your application and then assign you through and try to match you with somebody that shares similar research interests. So you can always request somebody, but we can't always guarantee that we're going to be able to make that request. And also something to keep in mind is that while we'll give you a faculty mentor when you come through the door, that's really just to give you a starting point. You really can talk to any of the faculty members in BSHE, or I'm sure, I've had students make connections across Emory. So we really just want to give you that starting point, but you really can, especially within BSHE, talk to any of the faculty mentors.
All right, Michaela is asking, up to how many semesters can you defer if you are doing a year or two of service, like Teach for America or Peace Corps? If you're doing Peace Corps, I know for a fact you can defer up to 2 years. For Teach for America, I think that's a 2-year program or 1 year. Basically, it's however long your program is, your service program is, then you would be eligible to defer for up to that long. If you're not deferring because of a service program, then you can defer for up to 1 year.
Okay, so it looks like Ashley is asking, how are courses generally formatted? Are they more lecture-based, discussion-based, group projects? So I think, it depends. So a lot of those 500 courses, those courses that required of you in other departments. Those do tend to be a little bit larger when you start to talk about those BSHE specific courses that are typically only taken by students within the BSHE department. So say, for example, theory and behavioral sciences and health education, behavioral methods, qualitative methods. Those courses are typically around the 20 to 25 range. And then even smaller for the capstone courses, those are typically capped at either 10 or 12. And those courses, all those courses are typically about 3 hours long, especially those with that are specific to the BSHE department. So you'll find that some of it, part of the class is lecture, part of it is discussion, and then if the class has a group component, and many of them do, we'll have some group work involved as well. A lot of the classes in which you're working with a community organization tend to be a little bit more group-based.
And most of that covers, I think, Iona's next question, which she's asking about how big are classes, which we covered. Total cohort, so we usually bring in anywhere between 530 and 550, 530, 550 students each fall semester. And then that's broken down, obviously, by the 7 different academic departments that we have.
And then in BSHE specifically, we're bringing a class of around 90 to 100 each year. So our total number between the first and second year is around 200 students.
Okay, so no more questions as of right now, it looks like. If you do think of any that you have or that you would like to ask, then feel free to email this the BSHE at rollins@emory.edu email account, and somebody will certainly get back to you, and we can help make sure that you get all of your questions answered. So with that, I think we're going to go ahead and wrap it up. When we end this, a survey will pop up on your screen, and it would be a huge help to us if you could take that. It's very quick, I think only 4 or 5 questions, and it just kind of helps guide us when we're making these different sessions and make sure that we're addressing all the concerns that you guys as prospective students have. So it would be a huge help if you could fill that out for us. But with that, thank you so much for joining us, and be on the lookout. We'll send an email when this is posted on the YouTube channel. So if you want to go back and review anything, you can easily do that. Thanks, and I hope you all have a great day.
Thank you.